Everyone, today I am going to make you clear on the topic of pituitary gland lesion. Okay, this pituitary gland lesion, under pituitary gland lesion we have to study about this adenoma, next carcinoma and craniopharyngioma. Okay, so these are also the important topic for the NEET PG entrance examination. Now, what are the most high yield points? Okay, we have to remember this as @SLA. SLA, in the SLA we have for A these acidophilic cells. So we have to know what are the cells that are acidophilic in nature. So the acidophilic cells, they are somatotrope and electrotrope. Okay, so for by this mnemonic you can remember these terms. Okay, so remaining all the cells, they are basophilic in nature. Okay, so basophilic, they are corticotroph, thyrotroph and gonadotroph. They are basophilic cells. Now the important term there is these ADH and oxytocin. These are released from the posterior pituitary gland, and these hormones, they are stored in the herring body. So this is also one of the important MCQ. Now, under the pituitary gland lesion, we have discussed there is one pituitary adenoma, pituitary carcinoma and craniopharyngioma. So first we have pituitary adenoma. So many questions are asked on this topic. Okay, so first one we are going to deal with this pituitary adenoma. Okay, so pituitary adenoma, under this the first question will be this: the most common pituitary tumor. Okay, the most common pituitary tumor is pituitary adenoma. Okay, the next question: the most common pituitary adenoma is prolactinoma, and this is also known as electrotrope cell adenoma. Okay, so these are the two questions that are most commonly asked. Now there are two types of pituitary adenoma. So what are the two types? First is microadenoma and macroadenoma. So this is based upon the size. Okay, if the size is less than 1 centimeter, it should be called as microadenoma, and if the size means if the diameter of the tumor is greater than 1 centimeter, it is known as macroadenoma. Okay, now this microadenoma is most oftenly, it is functional type of adenoma. Functional type of adenoma means it produces the hormones in excessive amount, but macroadenoma is most usually, okay, usually it is non-functional adenoma, means there is no any clinical features are seen due to increase in the level of the hormone, but the clinical features are seen due to increase in the pressure, of the surrounding tissue that is present surrounding to the tumor. So optic chiasma, if there is pressure on the optic chiasma, it will lead to bitemporal hemianopia. So this is the only, it causes something mass effect. Okay, that is only the symptom that is caused by macroadenoma. So there is no any increase in the level of the hormones level is normal in the case of macroadenoma. Now this pituitary adenoma, what are the gross features? Okay, what are the gross features of pituitary adenoma? So the kidney, if the lesion we see in the kidney, it will be well circumscribed and encapsulated tumor, as this pituitary adenoma is a benign tumor. So if it is a benign tumor, so what are the features of the benign tumor? Benign tumor should be encapsulated and it should be what? It should be well circumscribed. So these are the two features of the pituitary adenoma. Okay, now what are the microscopic feature? It is important. Okay, so microscopic feature of this pituitary adenoma, so there is seat of the monomorphic cells. Monomorphic cells means mono means single and morphic means their morphology. So all the cells, they possess a single morphology, they have the same similar morphology. Okay, means same shape and size. And what is the shape of these monomorphic cells? They are polygonal cell, mostly round and polygonal cells, and there is very less reticulin network are present. Okay, so in a normal pituitary gland, if we see the cells, there is presence of the reticulin network. Okay, on staining they will appear black, but these pituitary gland that is affected by pituitary adenoma, there is not present of, there is no any reticulin networks are present. Okay, so there is sparse or no reticulin network in the pituitary adenoma. Now you can see the micro, so this is image based question that can be asked. Okay, so you can see the monomorphic cell, these cells are round. Okay, these cells are rounded cells. Okay, and these are called as monomorphic cells. Okay, so this is pituitary adenoma. Next pituitary lesion is pituitary carcinoma. Okay, so this pituitary pituitary carcinoma. Carcinoma means it is a malignant tumor. So for the feature of malignant tumor, to tell it as a malignant tumor, there should be invasion, okay, invasion of the basement membrane, means presence of some metastasis. Okay, under endocrinology, to tell it as a carcinoma, there must be presence of metastasis, because other things like atypia, cellular atypia, these are also the feature of the malignancy or carcinoma. But in the pituitary tumor, in the endocrinology, we cannot tell it as a carcinoma without invasion. So invasion is the most important indicator in the this endocrinology. Okay, now what are the different pituitary carcinoma or other pituitary tumor, and what are the associated genetic involvement? Because to tell it as a tumor, there should be some mutation in the gene. Without genetic mutation, no cancer will be caused. So first would be the genus mutation. Okay, genus gene mutation. So I will help you to rememberize it. Like in the genus, the last letter is S. Okay, so S in the somatotrope, there is S. So by this you can understood. Okay, so this is somatotrope adenoma. So in the somatotrope adenoma, the gene involved is genus gene. Okay, so next is corticotrope adenoma. So first letter you can remember the first letter. Okay, C for corticotrope, C for CDKN1B gene. Okay, CDKN1 B gene is involved, okay, in the corticotrope adenoma. Now next is MEN1 type of gene. It is also important. MEN1 type of gene. So it possesses 3 letter. Okay, it possesses 3 letter, means there is involvement of 3 adenoma. It can cause 3 type of adenoma if it is involved. So first would be somatotrope adenoma, lectotrope adenoma, and corticotrope adenoma. So you can remember as a mnemonics SLC. Okay, at the rate SLC. Okay, SLC, somatotrope adenoma and lectotrope adenoma and corticotrope adenoma. So SLC, men means 3 letters, so you can memorize that it consists of 3 tumors. Now other mutation is important, like HRAS gene mutation. Okay, so HRAS is actually present in the carcinoma, so you can remember it as present in the carcinoma. So there is pituitary, in the pituitary carcinoma, gene involved is HRAS gene. Okay, now next is dicer gene. It is if it is mutated, it will cause pituitary blastoma. Now this is very important table. Okay, you have to remember. Okay, now next is most important. Okay, most important table that will tell us about the clinical features. If this tumor is caused, what is the clinical sign and symptom the patient will present with you. Okay, so the pituitary adenomas and their what is the hormones will elevated in the respective tumors, and what is the transcription factor that is involved, and what are the associated sign and symptom the patient will present. Okay, that is important. First is somatotrope cell adenoma. Okay, so this somatotrope cell adenoma, somatotrope means related to the growth hormone. So hormone elevated will be growth hormone, and the transcription factor most commonly in all the tumor, it is PIT1 transcription factor. Okay, it is involved, and if the growth hormone is elevated in the children, it will cause gigantism, and in the adult it will cause acromegaly. Okay, now next is lectotrope adenoma. Lectotrope adenoma, increased level of the prolactin, and the PIT1 is the same. What are the sign and symptoms? This is important. Okay, galactorrhea, amenorrhea, infertility, sexual dysfunction, and most commonly this lectotrope adenoma is most commonly seen more in the female than in the male. Okay, now thyrotrope adenoma, increased level of TSS, PIT1 transcription factor, and the sign and symptom the patient will present with hyperthyroidism. Okay, patient will present with hyperthyroidism. Okay, now next is corticotrope adenoma. Corticotrope adenoma, increase in the level of ACTS, and the clinical sign symptom patient will present with Cushing syndrome, Nelson syndrome, and mass effect. Okay, and next is gonadotrope adenoma, the increased level of FSS and LH, and there will be mass effect. Mass effect means due to the increase in the size of the tumor, it will on pressure to the surrounding tissue, and it will lead to different clinical sign and symptom. Okay, so like if there is pressure on the optic chiasma, it will cause some visual defect. Okay, like bitemporal hemianopia. So these are the mass effect of the tumor. Okay, now next, null cell adenoma. Null cell adenoma means there is nothing increase in the level of any type of hormones, but there is only mass effect as a clinical feature can be seen. Now next is plurihormonal adenoma. Plurihormonal adenoma means it is a mixed type of adenoma, means there is increase in the level of more than one type of hormone, like increase in the level of growth hormone, prolactin, as well as TSH. So it is a mixed type of adenoma, and there is also mass effect can be seen. Now the third pituitary lesion is craniopharyngioma. Okay, this craniopharyngioma, it is a suprasellar tumor. Suprasellar means it is present just above the sella turcica, okay, just above the pituitary fossa where the pituitary gland is located. Okay, now the symptom it can cause is the mass effect, and I already explained you. Mass effect means there is some pressure, and if there is optic chiasma, it will put pressure on the optic chiasma, and when optic chiasma is on pressure, it will cause bitemporal hemianopia. Okay, bitemporal hemianopia. Okay, this is a visual defect. Okay, now what are the gross feature? Okay, what are the gross features of the craniopharyngioma? So craniopharyngioma, it is its size ranges from 3 to 4 centimeter. Okay, grossly the lesion size is 3 to 4 centimeter. It is a well circumscribed tumor, and it is characterized by the cyst that is a true cyst, because it is lined with the cells. If the cyst is simply a space, that is cavity, that is filled with something, fluid, air, or anything, and if it is lined with the cells or epithelium, then it is called true cyst. If it is not lined by the true epithelium, then it is called as pseudocyst. So but the cyst in the case of this craniopharyngioma, it is a true cyst because it is internally lined by the stratified squamous epithelium. Okay, now it is filled with machinery oil. Okay, now microscopic finding. Okay, so what are the microscopic feature of this craniopharyngioma? Okay, so the microscopic feature of this craniopharyngioma occurs in two pattern. Okay, so one pattern is adamantinomatous craniopharyngioma, and next is papillary craniopharyngioma. So the most commonly occurring is adamantinomatous craniopharyngioma, and it is occurring in the pediatric group of population, like in children 5 to 15 years. Okay, children ranging from 5 to 15 years, whereas papillary in the adult. Now the cells that are proliferating here is stratified squamous epithelium, that is same in both the tumors. Okay, now the very important characteristic feature is the presence of the wet keratin. Okay, so this presence of the wet keratin, it is only present in the adamantinomatous craniopharyngioma, whereas it is absent in the case of papillary craniopharyngioma. Now calcification. Okay, calcification is occurring. Okay, calcification is present in the case of adamantinomatous craniopharyngioma, whereas absent in the case of papillary craniopharyngioma. Now presence of cyst most commonly in adamantinomatous, but absent in the papillary craniopharyngioma. Now reticulin. Okay, reticulin is present. Reticulum means simply a pattern. Okay, the palisading pattern of the cells are not arranged in a pattern. Okay, not arranged in a basement membrane, they are haphazardly located, so there will be disarranged cells. Okay, disarranged cells, that is the reticulum is present, but here it is absent. Okay, in the papillary craniopharyngioma. So we have to clear our concept from the image is most commonly asked. Now this is the figure for the most commonly, it is adamantinomatous craniopharyngioma, but we don't have to differentiate, we have to directly tell it as craniopharyngioma. So craniopharyngioma, you can see there is presence of cyst. Okay, there is presence of, this is the cyst, and this cyst is lined by the epithelium, so it is lined by stratified squamous epithelium, and it is a true cyst. Okay, now you can see the dark purple. Okay, you can see here dark and purple lesions, these are known as, these are the areas of calcification, these are dark purple colored. And the most important stain is also asked, vencosa stain or alizarin red stain can be used for the calcification. Okay, so to look out for calcification, we can use alizarin red, or we can use bone cosa stain. Okay, that is important, right? Bone cosa stain or alizarin red. Now next, there is presence of the wet keratin, and these wet keratin, they will look pink in color. Okay, they will look pink in color. You can see here there is the presence of wet keratin. Okay, so next is stellate reticulum. Okay, like there is presence of cells, and these cells are not located in a proper manner, these are disarrangedly located. Okay, so I can show you this. Okay, so you can see here the cells, these cells are haphazardly located, so this is the stellate reticulum. Okay, so you can see here the cells, they are haphazardly located. So that is stellate reticulum, and this is present in the craniopharyngium. This is the characteristic part. Okay, now this is also another figure. Okay, you can see here, these are the areas of wet keratin. This is presence of pink colored wet keratin is present. Okay, now next you can see dark purple areas. These are the areas of calcification. Okay, these are the areas of calcification, and these are also the wet keratin presence. Now here you can see that these are the tumor cells, and these tumors are what, stellate reticulum is present, they are haphazardly located. Okay, so these are the things, and you can see here one cyst, but this is one cyst. Okay, and that cyst is lined by the cells. So this is the figure all about the pituitary lesions. Okay, like pituitary adenoma, pituitary carcinoma, and craniopharyngioma. Okay, so this table is also very important, and figures are also important. Okay, so I think you have totally cleared your concept on the topic of pituitary gland adenoma. If you like the video, please subscribe and share among your friends.